medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In 1968, Haslin and Krebs reported out that an addition of 20 micromoles of oxaloacetate to a rat liver increases the NAD plus to the NADH ratio by 900% in 2 minutes. Now, everyone's always talking about mitochondrial disorders, but what do we do about them? And I want to discuss in this part and another part or two after this the use of a substance that holds a prominent position within the Krebs cycle, and that's known as oxaloacetate. I'm Dr. Mitch Ghen. Oxaloacetate is a human metabolite found in the citric acid cycle and it's found in pretty much every single cell of the human body. Oxaloacetate is essential to energy metabolism. It's available as a medical food with few reported side effects, maybe occasional gas. And it's so safe, the LD50 of oxaloacetate is greater than 5,000 milligrams per kilo in my study. It's basically classified as non-toxic, but as we get older, we have less and less of it. Now, studies have found that the use of oxaloacetate, or putting it back, could increase lifespan up to 25%. That's a lot. It lowers glucose levels to normal because it activates AMPK, adenosine monophosphate kinase, and has a very similar gene expression to caloric restriction, which we know how that helps the body to live longer and the mitochondria. Therefore, it probably reduces cancer risk significantly too. It's a powerful antioxidant and protects the mitochondrial DNA and the pancreas and neural tissues as well. Caloric restriction, of course, decreases cancer risk, so it would be assumed that using oxaloacetate made similar activation occur. And oxaloacetic acid supplementation actually prevents human lung cells, they've seen in vitro studies, and it never affects the normal cells. So cancer cells did not replicate in these studies after oxaloacetate solution was put in for 6 weeks. This was Farah's work in 2007. Oxaloacetate could place a very prominent position in the repletion of nutrients and something that's essential for the health of your patients as you try to help them with things like chronic fatigue, cancer, heart disease, etc., to help the mitochondria be healthier. In the next section, we'll talk more about and how to use oxaloacetate both orally, and eventually we'll talk about its intravenous possibilities as well. I'm Dr. Mitch Ghen, and for more information, go to drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.